Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. Your business to take care of your health. We did a series of really interesting commentaries, got some positive feedback about them. I guess it was in July, because July was, what month was that?
National Headache Awareness Month.
National Headache Awareness Month. Yeah, and it was also Kevin forgot what he was talking about month. But anyway, National Headache Awareness Month, very timely, and with a heavy focus on migraine headaches. I mean, that is such a pervasive problem out there, and I loved the topics. I loved what we covered. We also have them over at usdailyreview.com, and so if you put in Brian Loftus, or actually migraines, over at usdailyreview.com, several articles pop up prominently up there with commentary to go with it. And so, Dr. Loftus, good to see you again.
Thanks for having me back.
Tell us a little bit again, kind of give us the elevator speech about your practice before we get into our topic here.
So Bel Air Neurology specializes mostly in migraines. Most patients who need to see a doctor for headaches have migraines. Some have cluster, but the vast majority is migraine. We offer in-office rescue services. So if you're having a really bad headache and you're one of my patients, you can come there and get either a treatment or an IV therapy. We offer a lot of non-medical, non-oral medication treatments of migraines also, and that makes us quite unique. So people who are trying to get pregnant, just want to avoid side effects from medication they've had in the past, we offer them options as well.
Talk a little bit about wastefulness in your system. First of all, define what you mean by that.
Okay, so the medical practice is really messed up from a financial standpoint. So there are doctors who will do a procedure in the office and do the exact same procedure in the hospital. The patient does not need to be in the hospital, but the insurance will reimburse the procedure in the hospital 50% or 100% more than that procedure being done in the office. So what we've seen is a migration of hospitals buying up various outpatient facilities and practices, turning them into, quote, extensions of their hospital, and basically charging more for the same service. So we have incentivized waste in the medical system. And
why do the insurance companies do that?
So the insurance companies are working off of pricing information from the government, and the concept is that the hospitals have a higher overhead, and therefore they need to be paid more, but nobody took into the factor of, well, does that procedure actually have to happen in the hospital? So if somebody is hospitalized and they need to have a Botox injection, it may cost the hospital more money to get that Botox, and therefore they deserve a higher pay. But if that patient is simply being brought to an outpatient center that the hospital happens to own, I don't think they should still get that higher pay, but they do. There's also a Medicaid incentive program where if you're a hospital and you take Medicaid, the pharmaceutical firms have to then offer that drug at a decreased price, but not just for the Medicaid patients, but for everyone. So again, the government sort of sloughed off some of their funding mandate onto the pharmaceutical firms, but then open up this sort of very inefficient use of resources.
What percentage of what percentage of procedures that are being done in hospitals could be done outside of hospitals, in your thought, and not just in your area, but in other areas as well?
Yeah, so I don't know for all procedures, but if you think of like the radiology procedures and the number of MRIs that MD Anderson owns and Memorial Hermann owns and Methodist and groups like that, the majority of those are being done for outpatient procedures. So I don't know if it's
for outpatient procedures?
Correct.
For ultimately what will be outpatient?
For ultimately what could have been done as an outpatient. So I don't know if it's 75% or just 55%, or might even be high as 85%, but it's something
at a much higher rate, which ultimately we're paying for. We live in this little magical world that somehow, that's being done by a third party. Well, you're paying that third party, and the less fiscally disciplined that third party is, the more you're paying as a consumer.
Correct. I mean, it all comes back to kind of the total cost of healthcare. So it's either through your insurance or through the government and taxes. We're all paying for it.
Yeah. The average insurance company, this will blow most people's minds away, but it only makes about a 7.5% to 8% profit is the average. And so, you're looking at an extraordinary bill. You're looking at an extraordinary amount of waste in the end.
I think that's true. The other problem is, of course, when you first get your bill and what the insurance actually allows has become such a large difference, is that it's really become sort of a funny money with the billing. I think that's part of the problem also.
Yeah. Talk a little bit about procedures you're able to do, and you do right there at your facility.
Yeah, so we've gone mostly an out-of-network model. So our usual and customary are what folks pay. So we do nerve blocks for a few $100s and something called SPG block through your nose with the Alivio product for $250. And these are things that can stop your headaches or make them much less frequent. And commonly it's cheaper to come out of network and get treated by us than what your fees are to go to an ER.
Mm-hmm, mm-hmm. Yeah, and certainly, you're going to be paying deductibles anyway, and so why make those, and some of this is this considered insurance coverage? What's the attitude of insurance companies when it comes to some of this?
So most of the procedures we do are indeed covered by insurance. Mm-hmm. So they get applied to the patient's out-of-network deductible and fees, which many times is much higher than the in-network, but many of our patients have some out-of-network coverage. But then on the other hand, a lot of the patients who now have very large deductible insurances never meet their in-network deductible at all, in which case it really doesn't matter where they go. So our usual and customary fees, since people actually pay them, are, I think, pretty reasonable. We're $260 for a new patient, $155 for a follow-up visit. And our procedures, I think, are reasonably priced, with a few $100 is sort of the top of our procedures that we do. So I think we're very affordable and are a great option for people who just are having problems getting their migraines under control with the physicians they have been seeing.
Yeah, it makes a lot of sense to me. And then, people should really operate with a little more optimism rather than pessimism. I say, we generally get a higher deductible insurance rather than lower deductible, be it my car or be it my health insurance. Operate with a little optimism. And so to me, it makes perfect sense to operate directly through someone like you than trying to knock away at the deductible in kind of an insane way. Then people can use their health savings accounts as well to leverage this type of thing.
Correct. If you have an FSA or an HSA, either your flexible spending account or your health savings account, that can be used at our office as well.
Yeah, absolutely. And so are some insurance companies better than others when it comes to this, or are you just seeing across the board kind of a disaster?
No, I think for covering these procedures that I would say are not yet at the completely proven with double-blind studies, we have some insurances like Blue Cross Blue Shield and Cigna, for example, will cover all these procedures, and some of them like United Healthcare and Humana don't. So it does vary somewhat the coverage that patients have, even if they were at an in-network physician.
Yeah. Talk a little bit about what you would recommend the listener to do, in terms of doing his homework, or her homework in advance to look into these kind of things.
So if you have migraines, I think you should go on the internet, and you can look at our website at BelAirNeurology.com and learn a lot about migraines and treatment ideas. And you can go, the American Headache Society website has a patient side of their website where you can learn about the concepts of migraine. And mostly we want to emphasize prevention for patients who have frequent migraine to get them under control rather than just taking pills when your head hurts. Yeah.
Talk about how that protocol typically works.
So if your headaches are 2 or 3 a month or more, then it's usually a good idea to go on a prevention drug. And so there are 7 first-line oral agents that we have and 6 different procedures that, depending upon what other diseases you have, your desire whether or not to take pills or not, we will pick one. Most of the medications, even if you're paying cash, I think they're all under $50 a month these days. Most are $20 or less. So the preventatives are cheap, the oral agents. If you want to do the procedures, you're usually looking at from us $250 to $300 every 3 months or so.
That's very reasonable.
I think so.
And it's done once a month. You come in once a month typically?
No, typically less. So getting you under control may be once a month, but once you're under control, if it's just for medications, it's every 6 months. If it's for procedures, and they run about every 3 months.
I think that's fantastic. Final thoughts before we have you go.
Too many people choose to suffer with their migraines. Their mother always suffered with their migraines, and so they do too. And there's just so many good treatments available now that are inexpensive for both when you have a migraine as well as to prevent them, that I don't think it's necessary.
And give us your website.
So Bel Air Neurology, just like it sounds without any spaces.com.
One more time.
Bel Air Neurology.
Yeah, .com. Make sure you check it out. I tell you, the opportunity cost alone, not only are you miserable, but you're all kinds of things that you're not doing, many of which are financially important because of that pain and that discomfort, and so people really need to look into it. And I, for one, am very hospital shy anyway. And so if I were suffering like this, I would be visiting your offices rather than any hospital I could think of.
Well, thank you.
You bet. All right, so when we come back, much more for you. Do want to remind you, best content here shows up over there at usdailyreview.com, and this is The Price of Business.